it is a huge step forward, and I can only commend the Minister and the National Mental Health Commission and everyone involved in developing this strategy. As the Minister has just said, it's a world first, and it actually looks in a very holistic way at all the factors that go to improving the mental health and well-being, rather than just the responses when the problems have got, to crisis point. So there's a lot that we can do to promote the well-being of children and therefore the well-being of adults, because if you prevent problems in childhood, you're preventing them in adulthood as well.
Do the solutions outlined in the strategy go far enough?
They are a fantastic step forward, and I think it's a matter of seeing them through now. I know there's been some announcements today about some 15 new specialist services that are being set up. Obviously, 15 in a country as large as Australia is not enough. However, I guess it's also looking at the role of the schools. It's looking at support for parents and in communities. There's a whole lot of elements of this. And if we do see it through, I think it will help a lot. I mean, I can just tell you, recently I did some consultations with kids and families around Australia, and I heard really shocking stories about parents being turned away from public health services, mental health services, with children as under 12 who were suicidal, and they were sent away and told they cannot be helped. Now, that is just not okay in this country. So we've got to get that boost. We've got to get those response services available to that younger age group, but we've also got to do the upstream reform to prevent the problems getting to that stage.
We are now looking at a situation where in New South Wales and then in Victoria, young people will come out of lockdown and re-enter the education system. As the nation's Children's Commissioner, do you feel like our education system is equipped enough to deal with the welfare and the mental health issues that a lot of these students will inevitably have? Probably not. I think we're really making this up as we go. I have to say that children have not been uppermost in our mind through the COVID response, and it's only at the 11th hour that we got into looking at the ventilation systems and their staggered return to school and look at more holistically at what children have suffered as a result of these extended lockdowns in particular. And so there's not been an awful lot of planning that's gone into this. And I do worry that teachers will struggle, because when the kids come back, some kids will be fine and they might have even advanced really quickly at home because they've been suited to the Zoom learning environment. But other kids, and many kids, will have missed out because they just haven't had the conditions in place at home to support their development and their learning. And so teachers are going to have, I think, a bigger gap in the classroom. And these kids that are struggling, they're going to need that extra help. I know that there's been announcements about some tutoring, extra help for those kids in New South Wales and Victoria, but whether it's enough, really, that remains to be seen. And I think we need to learn from the pandemic about how important it is that we focus on the unique needs of children, not just the needs of adults, next time we have a crisis like this. Yeah, I think that's a really good point. And I think young people in this country have really been at the end of dealing with all of this, and they're an afterthought. And I worry about that a lot, actually. Why have we done that? Do we make policy in a sort of adult prism?
Yes, we do. The truth of it is, and I've realised this in my short time as National Children's Commissioner, that children are not a national policy priority in this country, that adults' issues dominate, they take centre stage. Children at best are peripheral, but often are invisible. And so we're not naturally accustomed to thinking about the needs of children and recognising that children and young people's needs are not the same as adults' needs, and that sometimes actually it's better that we listen to them and find out what they need rather than assume we know. So that takes a very different kind of orientation, and we're on quite a journey learning how to do this. And I'm hoping that through COVID, and as we now assess what's happened to kids and we try to resolve the terrible mental health issues that have developed for young people and the learning gaps that will emerge, that we actually learn to better prioritise the needs of children in the way that this new mental health strategy is trying to do, that it does need its own focus, not just kind of an afterthought after the adults' issues are addressed.